Hello, my name is Mary Ekuruke. Today I'll be talking about diabetes and macrovascular diseases. What is diabetes? Diabetes is a condition where the amount of glucose in a person's blood becomes too high due to the body's inability to utilize it adequately. This could be as a result of none or limited production of insulin by the pancreas. Insulin is the hormone produced by the pancreas which enables glucose to be utilized in the body cell. There are two main types of diabetes. Type 1 diabetes. This occurs when pancreas cannot produce insulin. It is mainly seen among children and adolescents. The treatment for type 1 diabetes is usually insulin injection. Type 2 diabetes. This is when there is not enough insulin or there is insulin in the body but it does not work properly. It is normally called insulin resistance. Type 2 diabetes is usually seen in people over the age of 40, but in some countries it may be seen from the age of 25. Type 2 diabetes is the most common type of diabetes. About 85 to 95% of all diabetics are type 2 diabetes. It is treated initially with diet, increased activity, medication, and sometimes insulin. Prevalence of diabetes. There are about 3.5 million people diagnosed with diabetes in United Kingdom and an estimated 549,000 people that have this condition but are not aware of it. Complications of diabetes. There are two main categories of complications of diabetes. These are microvascular complications, which affect the small blood vessels causing problems to the eyes, retinopathy, nerves, neuropathy, and kidney nephropathy. Today, I'll be dwelling mainly on the macrovascular complications. These are the diseases that affect the large blood vessels that supply blood to the heart, the brain, and the lower limbs as a result of diabetes. Factors that contribute to macrovascular complications. This includes high blood glucose, insulin resistance, high cholesterol level or plaque or fat as we may call it, high blood pressure, history of smoking, abnormality in blood clotting. Macrovascular diseases in diabetes include cardiovascular or heart disease. Individuals with diabetes are at risk of heart attack and other heart conditions. It is estimated that 8 in 10 people with diabetes die of cardiovascular diseases. Some of the symptoms of cardiovascular disease include chest pain or a feeling of tightening and squeezing or pressure to the chest area. If an individual has autonomic diabetic neuropathy, they may not have these symptoms. Decreased tolerance for physical activity, chronic fatigue or tiredness, shortness of breath with minimal exercises, swelling of the legs and ankle, palpitations. Strokes. Individuals that have diabetes are more likely to have strokes than those without diabetes. Clot formation causes blockage in the blood vessels which supply blood to the brain. Those with diabetes also have high blood pressure, which can also cause abnormalities in the blood vessels to the brain and lead to stroke. Some of the symptoms of stroke include impaired speech, double vision or inability to see with one eye, inability to walk or reduced mobility, paralysis to one or both sides of the body, numbness or tingling of the limbs. Peripheral arterial disease. People with diabetes are at risk of narrowing of the large vessel of blood to the legs, which result in poor circulation. This may affect the healing of wounds to the legs, and in some cases it may lead to amputation. Those who have diabetic neuropathy may not experience this. Some of the symptoms of peripheral arterial diseases include pain in the calves, especially when working, coolness of the lower limbs, hair loss on the legs, ulcers on the legs that do not heal promptly, and pain in the feet when resting. How can we prevent macrovascular disease in diabetes? In order to reduce the risk of cardiovascular disease, stroke, and peripheral arterial disease in people with diabetes, the following steps need to be taken into consideration. 1. Knowing your blood glucose levels, blood pressure, and blood fat level, or cholesterol as we may call it. In addition to your daily blood glucose monitoring, the HbA1c test should be checked every 2 to 3 months. There are some targets that have been set that we need to look at when checking our levels. These targets may vary in individuals, and your diabetic team may suggest a different target for you. These targets include, for HbA1c, target below 48 millimoles per liter or below 7%. But for individuals who are at risk of hypoglycemia, their target may be 58 millimoles per liter or below that. Blood pressure. Target could be 130/80 millimeter mercury or less. Total cholesterol below 4 millimeter per liter. LDL, which is the bad cholesterol, below 2 millimoles. HDL, which is the good cholesterol, 1 millimole or above for men, and 1.2 millimoles per liter or above for women. Triglyceride, 1.7 millimoles or below. Reducing body weight if overweight. Any weight loss will be of great value to the health of an individual. Eating healthy. You may need to talk with your dietitian on the best plan for you in your diet. Engaging in physical activity. Doing something you love to do, such as walking your dogs, dancing, or swimming, may be of benefit in your general health. If you are a smoker, the need to work on stopping smoking will be very, very necessary. You may need to talk with your care team, and there are helps in all the NHS services. If you have any chest pain, intermittent pain when walking, facial or arm weakness, slurred speech, or any other signs of stroke, you should contact your GP or call ambulance. Let your diabetic team know if there are signs of neuropathy, such as tingling or numbness or loss of ability to feel pain or burning or shooting pains that may be worse at night. You need to check your feet regularly for injuries and protect your feet from injury if you think you've lost sensation to them. Ensure that you take all prescribed medication regularly. Report anything unusual in your body to your care team. I do hope that this information will be of some help to you. Thank you.